In terms of, how you can use a psychologist's service, it's different, and it depends on different people and where you're at, and what you need might change. So I might see a young person, once or twice, just for a bit of a general check-in. They might want to bounce off some stuff that's going on with them, talk about some strategies to prepare for something to do with treatment or to deal with something that's going on, and that might be all they need. I might work with another young person in a kind of more intensive, longer term way, so maybe seeing them weekly for a number of weeks to talk about, something more in depth. So maybe it's dealing with, particular memories about, cancer stuff that's been particularly difficult, or working on particular anxieties, or working on, talking with friends and relating to friends in different situations, or social anxiety or things like that. So there can be a whole range of different things that you might see a psychologist about. And I think that in most cases, psychologists can be quite flexible as well. So I think if you have the capacity to be able to access a psychologist, if there's someone, at a local youth cancer service or something like that that you can access, chances are they're able to, tailor their service to what you're needing at that time. And I think, certainly a psychologist is never going to, make you attend a set number of sessions, just because. It's all about where you're at and what you're needing. So if you see a psychologist for a couple of sessions and that turns out to be all you're needing for the time being, that's great. And then if you come back after you finish treatment and you realise there's actually more stuff that you did need to be able to talk about or work on, it's okay to come back.